Hello, everyone. Today is International Doctors Day, and I want to congratulate all the wonderful doctors who work in the field of medicine. I want to congratulate doctors in my family, whom I have many. I want to congratulate doctors at Jefferson Health, whom I work with. I want to congratulate my primary care doctor, Dr. Palko, who takes care of me. And I want to congratulate all the doctors who work in the field of aesthetic medicine. Sometimes aesthetic medicine can be viewed as a simpler form of medicine, which cannot be further away from the truth. Working in aesthetic medicine actually showed me that this field of medicine requires just as much learning, training, dedication, patient care as any other field of medicine. As some of you know, I also work at Jefferson Health, and some of you actually been my patients at Jefferson Urgent Care. And I did have opportunity of treating few patients who have developed complications after seemingly simple aesthetic procedures. And of course, because I also do aesthetic medicine, I get curious and ask them questions like, for example, where did you find this provider? And usual answer is on social media, which is fine. And then I ask, what kind of training did this provider have? I don't know. What kind of product was used? I don't know. Was the treatment provided in the clinic setting? No, the treatment was provided in somebody's house. Now, some aesthetic businesses can be in apartments or the homes that are adapted for aesthetic purposes. But there is a difference between this setting and when you are treated in somebody's living room on a couch. That's not such a good idea because now that couch becomes your treatment area. Then there is no guarantee of sterility and there is no guarantee that the infection will not be introduced during those treatments. Now, I'm sure you will never accept this level of care from your family doctor, but in aesthetic medicine, somehow it became acceptable. You have to keep in mind that some aesthetic procedures carry much higher risk than the procedures you can get at the doctor's office. For example, if I'm doing a laceration repair on the face, I'm not going to be thinking about the risk of blindness or the stroke because those procedures do not carry such a risk. But if I'm doing the filler procedure, for example, in nasolabial fold or in the nose area or in the temporal area, I better be very, very careful. I better check and recheck multiple times my needle placement, aspirate, use the ultrasound to make sure I did not end up in the blood vessel and I'm not going to cause this patient to develop blindness. So stay informed, stay educated, do your research, and approach aesthetic treatments with care. One more time, happy International Doctors Day to all the wonderful doctors working in all fields of medicine. Your care matters, your expertise matters, and your hard work and dedication does improve patient lives.